COVID-19 deaths in Illinois nursing homes are rising at an alarming rate. 3 weeks ago, about 25% of the state's deaths from the coronavirus could be traced to nursing homes. Now that number has nearly doubled. CBS 2's Mike Puccinelli joins us live from outside the Thompson Center with that story. Mike?
Jim, according to published reports, about 1/3 of the nation's 78,000 COVID-19 deaths can be traced directly back to nursing homes or long-term care facilities. And in Illinois, well, that percentage is even higher here. From Washington State, where the first cluster of deaths from COVID-19 was announced at this nursing home back in March, to Joliet, where more than 24 people later died at this facility along Larkin Road, COVID-19 continues to exact a heavy toll on the nation's long-term care facilities.
48% of all deaths so far to date in the state of Illinois are in nursing homes.
That's out of more than 3,000 overall deaths in the state. And the man who headed up Will County's fight against Ebola believes the numbers are actually much higher because Illinois doesn't require COVID-19 tests after death. We've had 3,349 deaths from COVID-19. What do you think the real number is?
Oh, I think the real number is probably at least 10,000.
And he believes a large percentage of those deaths likely happened in the state's more than 1,200 nursing homes and long-term care facilities.
So hundreds of people have died just in the United States from a death that was not known to be COVID-19 when they actually had COVID-19.
Ehrman says removing a loved one from a nursing home before they catch the virus may be the safest option. He acknowledges the difficulty of caring for such a patient at home, but says it could be the difference between life and death in some cases.
That's far superior than being in a death house.
The New York Times reports that 1/3 of the nation's more than 75,000 COVID-19 deaths are among residents and staffers of the nation's long-term care facilities. Ehrman says the best way to protect the 100,000 Illinoisans in such facilities is to put public health officials in the facilities with them, armed with a checklist.
To ensure that PPE be there for every employee, that every person is tested on a regular basis, which means at least once a week.
And he says no employee who tested positive for COVID-19 should be allowed to go back to work in a long-term care facility without taking 2 separate tests at least 24 hours apart. And of course, both have to come back negative for COVID-19. Reporting live outside the Thompson Center, Mike Puccinelli, CBS 2 News. Jim?
Mike, thank you.